Agenda is approval of the September 22nd minutes. Can I have a motion for that? Linda, Eden. And is there any additions or corrections? Okay, all in favor say aye. Aye. Opposed, same sign. Okay, motion carried. On to informational reports. We get the PCAP's monthly report. Becky? Okay, do we have any questions for Becky at this time? All the animals doing well? Sounds good. So have you been able to start, since you got the grant for the rehabilitation for the cats area? Okay, and then when will you start on that?
Brian Elsesser.
Before the end of the year. As soon as everything comes in, we're hoping before the end of the year.
Okay. Any other questions for Becky before we move on? Okay, we'll have the ETSB report. Jody?
Hello. We have really nothing to report at this time other than the PSAP construction is going well and as planned. Any questions, I'll be glad to take back to David.
All right, do we have any questions for Jody at this time? Okay, moving on, we've got the EMA report. Jason?
Good afternoon. You should have a report in front of you. I submitted, so you'll see on at least significant events with respect to COVID-19. I would suggest that about a third of my time is spent on one of those meetings or briefings with somebody about COVID-19. A third of my time is spent on responding to whatever happened during that third, and the other third's doing the remaining part of what you see on there is trying to get back to, like many of you, doing our day-to-day job while dealing with COVID at the same time. So probably the focus on COVID is we continue our every other week EOC briefs, and then on the alternate week with the EOC, we meet with the smaller group, the Peoria County Healthcare Preparedness Coalition, specific to COVID-19 type related things. And then I don't know what Monica shared with respect to contact tracing, but we continue to go through contact tracing, and the disease specialists and contact tracers continue to work through what they can do. Mondays, I guess, seem to be a pretty heavy day because we get a bunch of reports over the weekend. And then we continue particularly planning now, a lot of planning on COVID-19 vaccine campaign and reaching out to community partners that may find themselves inside one of the priority groups to be identified, and those have been provided to us. Guidance has been provided through the executive order, I think it's 2020 number 32, which includes the essential workers. So we're beginning to work through that essential worker list, because if you've looked at that executive order, that essential worker list is pretty exhaustive and who falls under those categories. So we've been asked to get an estimate on how much vaccine we would need in Peoria County to meet that demand, and so we're working through trying to get responses from a number of entities on what they want to do. So. Other than that, we did do some training with the Illinois Emergency Management Agency on continuity of operations, continuity of governance, and recovery plans. Those are 3 new annexes that have to be added to our emergency operations plan by the January 15th. So we're working on getting those, and then the equipment statuses. We continue to get a daily poll of what our outdoor warning sirens are doing, and you can see which ones we're working on getting repaired. And yesterday, I think we had to replace a fuse in one. So.
Do we have any questions for Jason? Steve?
Hey, Jason, may not be exactly in your camp, but the staffing for contact tracing, are we doing okay at finding staffing and covering positions that we're allocated for? Kind of give us a feel for how we're doing at the staffing part.
We are hiring contact tracers as we're able. I think that and this is just Jason's discussion with some of our staff, leadership team there at the health department, that position's, it's not an easy position for an individual to fill. I understand that the contact tracers are really struggling with response from individuals they're trying to contact, either getting somebody to answer a phone, and then if they do answer a phone, being able to get information out of them on who their contacts were, where they were, and things of that nature. So I don't
Brian,
know
Officer.
how many we've hired or we
Doing-
have on staff. I know yesterday I took 4 new ID pictures. But like I said, it's contact tracing is a difficult position, and we're doing our best to try to make sure. It's my understanding that we're not understaffed in that area, that the issue is not our ability to contact people, it's the ability to get individuals to provide us the information we're looking for. So,
Okay.
probably similar to what these gentlemen deal with on a day-to-day basis.
All right, thank you.
Any other questions for Jason at this time? Okay, thank you,
Thanks.
Jason. Next, we got the Public Defender's Report. Nate?
One. So this month I tried to provide a little more context to some of the statistics that have been provided in the past and will continue to be provided in the future. Last meeting there were several questions concerning some specific data and data points that I tried to address through my narrative. I have not provided those statistics to you this month because, number one, I'm not a master at using Odyssey, which is our record-keeping system, but number two, some of the statistics that were requested, there wasn't really a function for pulling those in an easy fashion. So I'm working with our IT department and with the circuit clerk's office to be able to provide more specific data to respond to some of the inquiries. But a couple of things I did want to touch on that I highlighted in my report are, the assistant public defenders in Peoria County, with the exception of myself and Kevin Lowe, there are 2 full-time lawyers, he and I. The remainder of those attorneys are independent contractors. They're part-time. So when you have full-time staff, as everyone knows, anyone who's ever worked in a business, if business increases, you either hire more people or you give the people who are there more work assignments. And sometimes that slows things down because there's only so many hours in a day, and you deal with that as a business. But when you have part-time attorneys, you can't stress them the same way that you do a full-time attorney or a full-time staff member. So you have to be cognizant of the fact that sometimes, for instance, when you see decreases, what I would consider a marginal decrease year to year with the felony cases, you actually notice the usage of the public defender's office from year to year actually has gone up since 2017, even though the total number of cases have come down. But the important thing to realize, or that I want to stress here, is that year to year, we're not sensitive to minor changes or what I would consider minor changes. And that's the same if these cases had gone up that same amount. But we have to be mindful that we're dealing with independent contractors, part-time attorneys. So the rule, kind of the accepted rule and practice in our office, certainly with all the stakeholders in the court, is it takes as long to finish a case as it takes. And I've said that many times before, that not every case is the same, not every defendant is the same. So one class 4 felony with can be resolved very easily in just a couple of hours. Another one might take months and months and months in a trial to get through. But the expectation is that when you're assigned that case, you're going to do the work that's required. So I want to make very clear that our people, particularly in felony court, which is what I've concentrated on this month, but I intend to do this for each of the divisions that we cover, we're working hard. We're continuing to take cases. I mean, 2020, because of COVID, is undoubtedly going to turn out to be a statistical anomaly. But once again, we don't control the flow of cases as they come to us. That starts with the police and forwarding those charges to the state's attorney's office, and the state's attorney's office making decisions about how many cases they bring into the court system, and then the judges making decisions about how many cases we end up with as the public defender's office. So in our reactionary capacity, we are going to continue to handle the cases as they come along. But because everyone is part-time, I do ask that everyone, when you're looking at these statistics, bear in mind that changes downward sometimes are really just right-sizing, and we're not even right-sized enough as it is. So I'm happy to answer any questions about my report or anything that's not contained therein.
Any questions for Nate? Steve?
I'll take a stab. First, thanks, Nate, for trying to educate us better on it. I want to make sure I understand the table you have on the felony cases where you've got cases filed, and then behind that,
Brian
so
Elsesser.
you take 2017, for example, you got 1,026 cases filed, correct?
Right.
And then you have 929 assigned in brackets. Give me the, what's the difference between filed and assigned?
Sure. So these, all my statistical data points are drawn directly from Odyssey, which is our record-keeping system. So when I run a report, which I had generated for this particular, kind of study, case study, I looked at, I asked them to pull all of the felonies that were filed in the year 2017, and they gave me a list. And then next to, or with that list is a list of attorneys who were assigned to those cases. So then I went through and took each of the cases that have been assigned to a public defender, and usually they come in groups because you transfer it to Excel, so you get a big, long list of Nate Bach, and I cut all those. So the total number of cases that had an attorney assigned to them at that point was 929 out of the 1,026. So that's something I'm working on with the circuit clerk's office to go through and review those to make the corrections that are needed. But also, some of these cases just don't have an attorney assigned to them because the person has never been arraigned. They may have a warrant. The case may have been dismissed at some point for some other reason. I mean, there were a few cases I went through 2018. It had a smaller number of unassigned cases. And
Brian
there were
Elsesser.
4 or 5 total that
Joined.
had been dismissed pursuant to charges being filed federally against that person. So that's a case that I would never expect to have an attorney assigned to.
Okay, then you move to the second column, just for clarity for me. So
Yes.
take 2017, you've got 734 assigned to the public defender's office, which was 79%. So of the 1026 and then of the 929 that were assigned an attorney, 734 of those went to the public defender's office. Is that?
Right.
I guess I'm personally kind of surprised that percentage is that high, and maybe that's just a good awareness for me that, 79 and it's growing. It's 88% of the felonies today get referred to public defenders versus other attorneys or other methods of being represented.
Right. I would say a vast majority of the felonies, certainly since I have been the public defender, and it's borne out in the statistics, are assigned to the public defender's office.
Is that, I mean, I assume that's common among communities of our size and that this is nothing unusual. There's no disparity in Peoria's caseloads and public defender assignments than anywhere else in the country. I mean, just gut feel, is this high or is this normal or what?
I would guess we're probably on par for counties our size in the state of Illinois. I mean, normally when I look at statistical comparisons, I tend to look at, for instance, McLean County, obviously, Sangamon County, Champaign County, other counties that I think are about our size and roughly our demographic makeup. I mean,
Brian
I don't think
Elsesser.
there's any
Yeah.
value to compare Peoria County to one of the collar counties. I mean, their populations are far greater than ours, and the composition of residents is going to be different than what we have. But I think this is about on par. One of the challenges with the public defender's office and with assignment of the public defender is there really isn't a defined standard for what an indigent person is. I mean, it can vary from individual to individual, judge to judge. A lot of it is about perception. And a lot of it's about, you have people that are 20 years old, for instance, and they live with their parents and they're unemployed. So they may have posted $5,000 bond to be released from jail, and that doesn't always indicate that they have any other source of funds. So I think that's where some of the, not really trouble, but the difficulties lie in determining how the classification of indigency is being determined here in Peoria. But I would guess these statistics, the assignment process versus the overall numbers are a little more difficult to derive from general reports that are available to the public online. But I do look at public defender reports pretty regularly from those other counties, and I feel comfortable that with our staffing levels, we're close to where we should be. I mean, obviously, I would always say we could use 10 more attorneys at any time, but I understand that there's a real resource issue that's always in play. So,
Okay, well, thank you. I just was really surprised to see that high a percentage that went to public defender. I just wouldn't have perceived it to be that high of a percentage.
Sure.
Any other questions for Nate at this time? Okay, thanks, Nate.
Thank you.
Okay, moving on, we're on to the resolutions. The first one's the WellPath Correctional Health Care Contract Extension. Can I have a motion to put that on the floor? Rob, second? Oh, thanks, Phil. Okay, Sheriff, you're going to take this one for us?
Yeah, I can, Mr. Chairman. Thank you.
Hold on a minute,
I
Sheriff.
apologize for doing
Hold
this
on.
remotely.
Hold on a minute, Sheriff. Thank you, Phil. Yeah. Okay, so Phil just mentioned that we need to spell health right. So, okay, Sheriff, take it away.
Okay. Well, what's in front of you today is an extension for the jail health care contract for detainees through WellPath. Formerly, this was Correct Care Solutions, CCS. They were absorbed here in the last year. Same company, different name. This will take us from January 1st, 21 through the end of the year, December 31st. And this, again, will just be an extension to the existing contract. There might be some questions. We have been under contract with this entity since 2014. We did an extension in 2017, then again in 2019. However, with everything going on, I have some severe reservations about placing this out for bid during a health pandemic. There's some also concerns about the LPN staffing model, which currently they're very hard to get, and I was afraid that it was going to increase prices over what we could negotiate. With this contract itself, the main pieces that we did do, we did negotiate our ADP. The contract's always based on the average daily population, and this has been at a number of 420 to 520. There's a reimbursement rate that we receive if we don't hit those numbers. So anything below 420, we were getting a reimbursement rate, and the company needed to get that down to a more accurate number. They tried to get it down to 250. We would not agree to that because I think that has taken us too low. So this contract was going to be based on an average daily population of 325. The other big factor that we did is we negotiated a pharmacy cap rate at $100,000. So if we go over $100,000 in pharmaceutical needs, we'll have to pay that over the contract. But from a historical perspective, the last 3 years, we've only gone over that amount one time, and it was $103,000. Additionally, with this pharmacy cap, if we come in under, we will get credit or reimbursement on that amount. So if we only come in at $80,000 for pharmaceutical, we would get a $20,000 check at the end of the year. Again, I know there might be some concerns with this being extended since 2014, but with the internal conversations, I truly don't think this was the right time, nor did we have time to put this out for bid, and it would be complicated with site
Brian
visits.
Elsesser.
Joined.
Again?
I'm sorry. I actually I was having trouble hearing the conversation in the background. The last few times I pressed it against my ear too hard and it clicked it off. So, sorry.
Okay. Yeah. So, yeah, this will extend it out. We do plan on taking this out for RFP in 2021. This obviously is a big contract. There's a lot of work involved with an RFP, and but for this year, the extension I truly believe is our best bet for safety as well as financially. I'd be more than happy to answer any questions.
Any questions for the sheriff on this? Steve?
I don't know if you can hear this, Sheriff, or not. Just, I guess in general, the cost of this compared to the cost of the delta between the extension for 2021 and what you're paying now. I know there's a ADP difference and there's some other factors. Can you give us kind of a sense of, or is it pretty much on par, or is it dramatically higher or lower?
It's coming in compared to what we're paying here in 2020. This next year, it's going to be an annual increase of roughly $63,000.
Okay.
And again, they came in actually a lot higher than that because, you know, they have the leverage right now with the market, especially on LPNs. This is a degree that's no longer being facilitated by a lot of colleges and universities, and a lot of these correctional healthcare models are switching over to an RN model, and it's scarcity of resources as well. There's a lot of different agencies, whether it be hospitals, nursing homes, you name it, they're all looking for this same applicant pool, the LPNs, and so they have to increase their prices to have the staffing adequate. And that's reflective in this.
Any other questions for the sheriff? Any questions for Scott or anybody? All right. All in favor say aye. Aye. Opposed, same sign.
Aye.
Okay, motion carried unanimously.
Thank you.
Thank you, Sheriff. Okay, the next one is the medical and mental health care services at the Peoria County Juvenile Detention Center, Detention Center. Okay, going on to the next one. Sorry about that. Can I have a motion to put that on the floor? Eden, a second. Sharon? Okay, Brian, are you taking this one?
This Brian is, yes. Here.
Okay, there we go.
Good afternoon. The resolution in front of you, to piggyback off what the sheriff said, the same exact situation back 2014. We broke off in 2017, separated out the contracts. So what's before you is 1 year extension, basically all the same reasons that the sheriff has stated. It is a 3% increase, which is lower than the 5% CPI medical component. They did come in at 5%. We negotiated that down to 3%. So that goes up to $331,319. Be happy to answer any questions anybody may have.
Now, is there anything in there for increases or decreases of population?
So mine is quite a bit similar, simpler than the sheriff's. It's not necessarily tied to ADP. Medication costs aren't an issue in juveniles, as most of them are covered through the state plans or private health care. We pay very little on medication, to the tune of a couple $1,000, $5,000 maybe. The rest of it is reimbursed, and that's part of that contract. So ours is a lot more simpler than some of their medication cost and things like that. So.
Anybody else have questions, Steve?
Can't let you off that easy, Brian.
Okay.
What's your level of satisfaction with the performance of your current vendor now, and kind of give us a flavor or a sense of where you're at as far as acceptance and their quality of work?
It's been excellent for the most part. It takes a while to develop some of those relationships, and switching providers is always rough. But we've been with them, since 2014, and it's been good. We've had stable nursing. Another difference in what the sheriff had spoke to, in juveniles, you have to have RNs, the staff, so there's a little bit difference there too. So you get a little bit more stability, generally speaking, with RNs, and we've had that for the last 3 or 4 years. It's been pretty stable. So overall, very happy.
I assume your position is you're looking at putting it out the bid for the next cycle then?
Yeah,
similar
so
to the
we
sheriff?
would, the sheriff and I and the county administrator would put that out together and have separate contracts, but it would all go out as one RFP. I believe that is the intention that we would do early next year.
Okay.
Any other, Phil, go ahead.
No, we charge them extra medical fees and things like that.
Any other questions? All right, all in favor, say aye. Aye.
Thank you.
Opposed, same sign. Okay,
Aye.
motion carried unanimously. Okay, last on our resolutions, animal control agreements with Becky. I need a motion to put on the floor. Rob, second. Kate, thank you. Becky, go ahead.
All right, these are our animal control contracts for service with the varying municipalities. You'll see that there are 13 full-service contracts. There's one impound only contract, and then there's one municipality that has opted for no contract this year. The financial impact of the no contract was Norwood, and they're very small in size. Per capita, they're only 465, and so it's an impact of about $1,000 a year. And in the history of that group, they have opted out of contracts before and then come back to us.
So if they opt out, what kind of services do we provide for them? I'm sure there's a basic one, but if you could explain that.
Yes, so if a municipality opts out of a contract that's full service or even impound only, the only thing that we are obligated to provide per the state statute is rabies control. So reports of bites, making sure that we're directing folks to quarantine animals, that kind of thing. There's some reimbursement for like livestock kills, should that happen, just the very basics.
Okay, any questions for Becky? And everybody seemed fairly satisfied with what the contracts municipalities did?
Yes, yes. So I was able to attend some meetings virtually, but some folks, and I would say the good majority of them, just renewed contracts without even having me attend a meeting or speak to anyone. They've just been happy with the service in the past and move forward. It's been great.
Well, that's always great to hear. Any questions before we vote? Any questions, Mr. Chairman? Okay. All in favor, say aye. Aye. Opposed, same sign.
Aye.
Okay, motion carried. We're to miscellaneous. Does anybody have any miscellaneous today? If not, we're adjourned. Thank you.
Asbel.
Left.